Lungs are essential for our survival. They deliver oxygen and expel carbon dioxide. However, conditions like COVID and post-COVID fibrosis threaten lung health. Chronic respiratory diseases affect millions, lowering quality of life and adding healthcare costs. Understanding lung damage reveals it's caused by smoking, infections, and pollutants. Lung tissue engineering is a promising solution. This field creates functional lung tissue through scaffolds and cultured cells. Researchers face challenges, mainly ensuring the engineered tissue is vascularized, but breakthroughs are on the horizon. Stem cell therapy is another exciting avenue. Stem cells are powerful because they can become any lung cell type. Early clinical trials show potential in treating lung damage from COPD and COVID-19. Molecular repair therapies target lung damage at its roots. Gene therapy introduces the right genetic material for healing. Antifibrotic agents and nanotechnology enhance treatment delivery and effectiveness. The future of lung regeneration looks bright, but ethical considerations remain crucial. Collaborative efforts among researchers and clinicians will ensure these advancements reach patients responsibly. Join the conversation on lung regeneration and share your thoughts in the comments below.